Hello, everyone. I'm Dr. Rohan Khandelwal, your Marrow General Surgery SS faculty. And it's an absolute honor to be introducing Dr. Ritvik Chekuri to all of you. He secured rank 1 in the recently conducted AIIMS SS exam. And this is rank 1 in the most competitive branch in MCH, that is GI surgery. So, heartiest congratulations from the entire Marrow team. Dr. Ritvik, how are you feeling? I mean, has it sunk in?
Thank you very much, sir. So I couldn't believe it when I saw the results, but yeah, now it has sunk in and it's very exciting.
That's great. So you were in UG PG from AIMS Delhi, and then you'll be continuing your journey in AIMS. So why don't you just tell us about how you started preparing for the SS exam? When did you start preparing, and what role did Marrow SS play in your preparation?
Okay. So I've always wanted GI surgery, but I did not start preparing for it. So last session in I think April, some 25 days prior to the exam, I've decided, okay, let's do whatever is possible. I finished the Marrow videos, but however, general surgery part I've not covered as much. So I couldn't do it last time. I did not even qualify for the second level.
Right.
So
So this
after
was
that,
way back in 2021.
no. So I finished my MS in July 22. So this was
Okay,
last session.
22.
Yes, sir.
Last session. Okay.
Last session. So after that, my exams were done, and I've decided I'll take a break. I'll study and see, because I've seen the 1 year gap between
Between
MS
GI
and
surgery.
getting selected. Yeah, and I've also seen most of the people were taking a break. And from personal experience, the residents I know, they've also suggested that I take a break and study, because there are two books that I have to refer from. It's not a single book, and a half-hearted preparation would probably not be enough. So I decided to take a break, and then I've started after my MS ended.
Perfect. So after your MS ended, how did you divide your time amongst the Marrow videos and referring to Shackleford and Bloomgard and questions? So how was your time divided in over the last 6 months or so?
Okay. So one thing was, because there was a delay in the NEET super specialty exam, and it
Right.
was, I think everyone thought that it would be somewhere around October or November, because of all the delay at that point of time. So my initial plan was to read both of them simultaneously, but the new date, the September 2nd date, that was a shock. And so I decided, okay, let's do only general surgery part. Um,
Okay.
I've read a few of the topics in in Shackle in Sabiston pretty well, the breast endocrine and few other topics. Then so I basically read the GI surgery part from Sabiston, and I saw all the Marrow videos. I did not refer to the GI surgery part, but I've seen breast, thyroid, and all the remaining parts, skin. Then there is oral cancer, salivary glands, all these parts, and the general part. So
The
and
trauma and the general part.
trauma, yeah, trauma is something that has been a constant. I've had your notes since a long time for trauma, and that
Right.
has always been this. It is the same thing that I've continued reading, and the all the updates. So trauma is something that is extremely good in the Marrow app, along with breast
Right.
endocrine. Breast, I don't think anyone has to refer anything extra other than what's there in the Marrow app. So what I did was, I saw the videos of breast and marrow, and then I thought, okay, NCCN also I had to refer. I thought INI will ask from NCCN also for the general part. Then I realized you've already covered everything that's there in
Right.
MCCN. So
Right.
breast was, and INI has a huge focus on breast
Yeah, that's
usually.
because of the
So
strong breast department in the AIMS faculty. So I think so. That's
yeah,
why
yeah,
breast questions will always be there. Yeah.
breast, endocrine, parathyroid, and thyroid. Always there are questions
Mm.
from there, and so thyroid also was very good. But I always felt that because you covered mainly Bailey initially, that
Mm.
could put me in a disadvantage. Once the videos were updated with points from Sabiston, I only referred Marrow notes for the general surgery part in for the NEET SS. So the last
Yeah.
week, I've only read the notes, and I actually always feel that okay, videos are taking a lot of time. Even after watching 2x, I just feel like okay, I want to refer the notes because I can look through the points I already know and just learn about the points I do not know. And then if a concept is not clear, I would go to the video and see only that part, because there's time mentioned in the notes. Okay, so you can go to this time and refer to these points. So I used to do only that. I used to read the notes, and only if there is some point that it was not clear, then I would go back to the videos and see.
Yeah, I mean, it was a conscious effort. We It took some time to update the videos with the new Sebastian content, but now that the videos have rolled out, I think so they're making an impact because lots of questions are based on Sebastian only. And
Yes, sir.
you rightly said that INI, there's a huge focus on endocrine, trauma, and the general part. And what I have seen a lot of times is that, specialty, everyone prepares really well. But it is sometimes these general surgery questions which are the decider whether you get rank 6 or you get rank 2 or rank 3. So one should focus on it, especially when they are preparing for the INI SS exam. So, can you elaborate on the GI surgery part as well? You said that you did refer to some of the marrow content, not all the videos, but can you just highlight for the users how should they go about preparing for the GI part?
So for the GI part, sir, I've seen all the videos.
Okay,
I've seen all the
right,
videos even prior to the last session.
perfect,
So
right, right,
this
right,
time, since the notes were uploaded,
right,
so I only saw the notes this time from Marrow, and what I've done is I've read Shackelford most of it, and I think 50-60% of Bloomgart. So
So,
in
did you
those
do
ones,
this? I'm sorry, I'm interrupting you, but did you do this reading of Shackelford and Blumgard during your 3 years of post graduation, or all this was done during the last few months?
it was done in the
After,
last 1.5 month.
wow. So, I mean, last 1.5 months, how many hours were you putting in to read Shackelford and Blumgart? Almost 50 to 60%, or you were being selective? You noted down which topics are important, and you were just going through them.
Um, so, sir, Shackelford, I've read cover to cover. I think more than 90%. There was no selection in topics in Shackelford.
Right.
Bloomgart, I've initially started to do a selective kind of thing, but when I saw the topics and whichever I felt were important or potential questions, I used to read them. And I used to read in a very haphazard way that I used to read Shackelford, and each day I used to read one topic of Bloomgart liver,
Okay.
because since it was a very small time, and Bloomgart was a whole another textbook that I had to see. So I used to do this. I used to see a topic from Shackelford, and every day I used to ensure that I read some part of Bloomgart also. So that kind
So for
of
revision, I mean, when you have to revise in a short span of time, you refer to the Marrow notes predominantly to revise the entire GI part as well.
no, sir. I made my own notes
Okay, right. So can
on.
you elaborate on that? Because a lot of students often ask us that, how do you make a book like Blumgart and Shackelford in a concise manner? How do you revise it in the last week? Or how do you revise the entire notes in the last week? Can you just elaborate on that so that it can help other users as well?
Yes, sir. So, like I've told, I had whatever sources I had. I used to note down points from all of them, and since I was reading in a very haphazard way, I could not write in a physical book.
Right.
So everything was on OneNote.
Okay, perfect, perfect.
So
Yeah.
whenever I had to add a point, I used to create space and add points. I kept on adding, and most of the time in the first reading, I don't even know what I wrote. I used to just keep on adding points, and I just knew that okay, I've compiled everything there. And so once I've compiled all the notes, I think I kept 10 days, 20 days for two revisions, sir. In the end,
Right.
so 10 days for each revision. That was how I planned. And for colon, esophagus, and liver, I kept 2 days each, and rest of the topics I kept 1 day each.
Perfect.
And I managed to do most of them twice, revise twice before the exam.
So I think so that's a very important point because a lot of times we find that a lot of students don't revise. So writing down stuff and to make it concise, what you did in 3 4 months, it's pretty doable. Of course, you weren't working, but it is doable. And if you can make things concise and you can revise them, that's when it is going to have a real impact. Coming to WorkX, so I always wanted to ask this question in the second round when you had the interview. So does work experience count if somebody has worked in the GI surgery department? And can you also tell us what all type of questions and images are asked in the interview so that it can help future aspirants as well?
Okay. So personally, I was asked if what I was doing for the last 6 months. They've asked me this question, and I think they've asked this question to everyone. So what we were doing? Were we taking a break, or were we working? And but at least in my case, that did not affect the score. But I don't know if they actually give importance to it or not. And most of the
Right,
questions, so in the interview, they've asked me about the work experience part, whether I'm working currently or have I taken a break. And this question they've asked to everyone that I know who gave the interview, but I don't know if it has affected how they evaluate the candidate or not. But for the interview questions part, what they mainly asked was how would we manage a patient who will come to the casualty. So from the beginning,
right.
how we'll initially stabilize the patient, how would we go stepwise, what investigations, what differentials would you have, and how would you manage. So they had a fixed time in which they had to ask a certain questions. So yeah, those questions were pretty basic, but yeah. So there was a separate round for spotters, sir. The 8 spots were asked,
Right.
and it had, I think, most of the questions were images. They were like you have to identify what it was, either a specimen or it was a radiology. There were 2 or 3 radiology questions, specimen questions.
Anyone which you can recollect?
um, I think there's always a question on ABG.
ABG. Right, right.
Yeah,
Got it.
and they've asked us if liver lesions is again a favorite for them. Pancreatic lesions is again a hot topic. So these are standard important images for a GI surgery aspirant. Those are the
Sure.
things that they asked. Nothing which was out of the blue.
Right. And while we were discussing, you also told me your rank in the NEET SS exam was in the 300s. So, you have, of course, told me your approach since the NEET exam till the AIIMS SS exam of how you changed things around and what all changes you made and how you revise. But for somebody who's just preparing for the NEET exam in mind, what would be your advice for them?
So for the NEET part, I did not refer to the old question papers. One, because this time it's a completely new pattern, and two, it was a clear lack of effort from my side. So I did not refer to the old question papers, and I thought it would be predominantly from the general surgery part, and the super specialty questions would probably be very minimal or very basic. And since I knew that last time there were many questions from urology and pediatric surgery, so I've read those topics a little more in detail, and I haven't
But
touched CTVS at
yeah, this
all.
time there were a lot of questions from pediatric CTVS, which was very
Exactly.
strange.
So
Yeah.
that was quite a shock, and but luckily those options in NEET were so simple. Like they want you to answer the questions in NEET. So I could easily exclude a few questions, but yeah, clearly the entire thing was not good enough, right? I got 395 in NEET. Um, but
Did you see the previous question paper discussions which we'd uploaded on the Marrow app, the INI and the NEET SS papers which we discussed?
I've seen all the INI previous year discussions, sir. I've not seen the NEET previous year
The NEET.
discussion.
Sure, sure. So your
But
advice would be to go, of course, see the previous paper, see the trend. But what I've seen in the last two NEET exams is that there is a lot of unpredictability. I mean, there's one particular topic they choose, and then they just ask a lot of questions. Ritik, what I want to know is where did you practice questions from, and were you appearing for the mock tests which we were highlighting on the Marrow app?
um, I think I've given all the mock tests in the GI surgery part, sir. And
Right.
my concept of giving the test was whenever I did not have the motivation to study,
The mock test used to
Right.
scare me to study.
Right. Yeah. So that's one way to look at it.
Yeah.
Perfect.
Because
Perfect. And
like I
how were you performing in the mock test? So was your rank correlating with the rank which you've got now?
I think in the GI surgery, the last few grand tests that were there, I was third or fourth, something, third or fourth.
Okay, so good correlation. So I spoke to somebody who secured rank 4, and they
Uh,
also said that their rank was correlating when they were appearing for the grand test. Other than that, the Q bank, which has now been recently added for the specialty as well. Did you get a chance to refer to the Q bank as well?
I wanted to, but it was still an incomplete when
Right.
I
Yeah.
was looking, and so I decided, okay, let's not do it because it's incomplete, and I have to select which topic to see and which topic to not see. So I did not do it at all.
Yeah. So now it's been completely added. So we were
Uh,
taking time again. I guess when I was talking to other students as well, we tend to put in only those things when we are very confident about the answer and the resource. So that's why it was taking time. But now it's complete for all the specialties. So
that's
thank you very much, Dr. Ritvik. Thank you for taking out time and talking to us. Congratulations once again. Any
thank
last words of advice for anyone who's planning to start their SS preparation? And according to you, like you started post your graduation, post finishing your post graduation, but what would be your advice to somebody who really is focused about a branch? When should they ideally start?
you. So personally, I would think that during the general surgery, concentrate in the wards and concentrate on what you can learn, what you can do. Uh,
Right.
I've I've heard many people say previously that they've read Sabiston Bailey 20 times, 30 times, which was seriously for me, it sounded impossible for me to do. I don't know. I thought I'll concentrate on my residency and I'll do the super specialty later. It's definitely hard if you do it later. You'll have to work very hard for a few months, and it's very easy if you start early. But I wouldn't have done it any other way.
Perfect. And one last question. You said that you refer to the general surgery content, the trauma, the general part, breast, thyroid, and the miscellaneous topics. How long did it take you to cover those videos, and how many hours were you putting on a daily basis?
Um, so, like I told, I used to look at the notes mainly, sir. Um, so for me, each module used to be 1 hour. 1 hour was my standard. Whatever module it was, whatever video it was, the maximum time I spend on it is 1 hour. So if I wanted, all the important topics for INI would have been done in 1.5 day.
Perfect. Perfect. So I think so it's pretty doable, and then you can revise it again and again to reinforce those
Yes,
points.
yes, sir.
Yeah.
Because there are many unpredictable questions. What we know for sure, if we are good in at least those parts, the other parts, your effort might not be fruitful, but at least what we know will
True.
come, at least that we should do well.
Absolutely. Great. So it was a pleasure talking to you. Thank you very much, and all the best for the future. Thank you, Dr. Ritvik.
Thank you, sir.